Well, it caught everyone's eye as a new celebrity trend, and tonight in part 2 of our Fox 12 investigation into IV therapy, we look at the debate over the growing use of IVs as a treatment for everything from fatigue to cancer. For years, teacher Cindy Christensen suffered from a severe and complicated case of Lyme disease.
Couldn't get out of bed, in terrible, excruciating pain, muscle pain, joint pain.
She was so disabled that for a few years, she couldn't work.
I mean, this is what's getting me through every week.
Once a week, Cindy gets an IV filled with a cocktail of vitamins, nutrients, and amino acids designed to fight her Lyme disease. Cindy is one of a growing number of patients here in the Northwest and across the nation treating everything from fatigue to cancer through IV therapy. The medical establishment dismisses IV therapy. Insurance companies consider it experimental and won't cover the costs. But naturopaths like Lake Oswego's Dr. Noel Peterson say IVs filled with nutrients specific to the patient can cure, treat, and prevent a host of illnesses.
Everything from asthma to cancer. Everything relies on diet and nutrition.
It was very ginormous hole in my head that, is healing up pretty well.
Surgeons recently took a tumor out of Georgia Hale's brain. She's undergoing chemo and radiation, and she's added IV therapy, high doses of vitamin C, to this regimen.
It's helping to strengthen my immune system.
And she says it's helping her fight her cancer. But most undergoing IV therapy aren't fighting life and death battles. The benefit of IV therapy, says Dr. Peterson, is that it gives you huge doses of vitamins and minerals when eating well and vitamin pills are not enough. However, many MDs doubt that IV therapy really works.
In terms of what I've seen, and I work a lot with people who give IV nutritional therapies, most of the time we have not seen it to be helpful.
Is there evidence there's a benefit? Dr. Miles Hassel says he's not necessarily against IV therapy, but the long-term controlled studies have just not been done. Patients, though, say it's working for them.
I was in a lot of pain, fatigue. My joints ached, just muscles ached.
62-year-old Doug Seaman suffered lead poisoning after drinking out of a hose with a lead lining for 2 years.
Saved my life. My blood pressure was off the charts. I was basically on the way to death.
Helen Murray, a piano teacher from Battleground, comes in twice a week to treat a severe viral infection that led to excruciating muscle pain, exhaustion, and respiratory problems. She says IV therapy is not a quick fix, but along with drastically changing her diet, this super-duper extra dose of nutrition gave her back her health.
I have my life back. I remember one Saturday, I suddenly realized, my God, I have my brain back.
Despite the glowing testimony from patients, Dr. Hassel still doubts that IV therapy is all it's cracked up to be.
It's important to remember that any time you put a needle into somebody, you get a very powerful placebo response.
And Dr. Hassel says anytime you put an IV into someone's arm, there's a risk of infection, even life-threatening infections. There are dangers, agrees Dr. Peterson, but he says, as with any medical procedure, you have to be careful. Many of these folks have tried conventional therapies before turning to IV therapy.
And I was hurting everywhere. My blood pressure was up, very high. I was in a lot of pain, fatigue, joints ached, just muscles ached.
We're all vulnerable to the profit motive. When you get paid well to do something, it's something you find reason to do.
And while some might just be money makers, like this Vegas bus that offers IV drips to gamblers with hangovers, IV therapy for others is part of diet and nutritional changes that may enhance conventional medicine or perhaps even help when conventional medicine hasn't. Now, some doctors also say IVs are an unnatural way of giving patients nutrients and should only be done on an emergency basis, not on a regular basis.